Well, Keynote 10 and Keynote 42 were clinical trials that looked at pembrolizumab as a single agent, Keynote 10 in the refractory setting, meaning second or more line therapy, and Keynote 42 in the frontline setting, both versus the appropriate chemotherapy. Both were positive trials, showing a superiority for pembrolizumab, the PD-1 immunotherapy, over docetaxel or over platinum-based chemotherapy. What we've done here is now that the trials have matured, we've looked at the data with tumor mutational burden as a potential predictive marker. We already know that tumor proportion score, PD-L1, could predict activity, but now what we've done is we've looked at the number of mutations by doing whole exome sequencing. And we looked at this in two ways, as a continuous variable of the number of mutations and also using a cutoff of 175 mutations per megabase, which had come from some of our prior work and other data sets. And actually the data were quite interesting. Granted, it's an exploratory analysis, though it was pre-specified, and the numbers are not the complete number of patients in the trial because there weren't enough samples or tissue to do every patient. We found that the tTMB was a predictive marker, both in trial 10 and 42, both for overall survival, progression-free survival, and response rate. Also using the cutoff of 175, both in Keynote 10 and Keynote 42, we were able to show that the group of patients that had the higher a number of mutations, regardless of PD-L1 status, seemed to have improved overall survival, progression-free survival, and response rate. So what does this all mean? It means that this needs to be validated prospectively, no doubt, but it also means that as we try to personalize immunotherapy, and we must, immunotherapy is historic in how it's helping patients with lung cancer, but it really only in the long run helps 15–20%, and we got to figure out how to get more involved and do better. We'll start to pick patients for single-agent immunotherapy using PD-L1, and now perhaps we can add in tumor mutational burden. And then, of course, we need other markers regarding other resistance pathways that we'll discover as they emerge. But it's a very exciting trial and one that I think will lead to other studies, both retrospective and prospective, in the not-too-distant future.